So let's say that you want to try and self-assess and self-treat. Well, let's walk through a strategy that you can use yourself right now to see if you can get a better handle on your shoulder pain symptoms. Now, let's say, for example, you wake up in the morning, you're feeling some shoulder pain when you go and do that big first stretch, or if you're trying to wash your hair or brush your teeth. The first thing you're going to do is you're going to compare the injured side versus the uninjured side and just get a baseline, get a sense of how much does it hurt on one side versus the other when I do a certain motion. So what I'll have you do is you'll sit in a chair, just like I am now, and we'll start by raising your right arm up into the air as high as you can go. Really get that arm up next to your ear and just get a sense of what is my arm and my shoulder supposed to be doing? How's it supposed to be moving? And then we go over to the injured side and try the same thing. And let's say I get it about to here, and that's as high as it'll go. No matter how hard I try, that's as high as it's gonna go. And so you take a peek, you assess it, but you also think, how much does this hurt? And you're gonna rate it. You're gonna rate how much it hurts. 0 all the way up to 10. 0 is nothing and 10 is unbearable pain. And there's no right answer, there's no wrong answer, there's just your rating. That's gonna be your baseline. So let's say I raise my arm up and it's really hurting in this area up here, and I'm gonna rate that at a 6 out of 10. And when I come back down, it's a little achy and a little uncomfortable. Well, I know my baseline, I haven't hurt myself. I'm just seeing what I can do and how uncomfortable it is. The second assessment you're gonna make is you're gonna take a look at your trunk, your spine, to see how far you can rotate one way or the other. Because if you remember from the other video, when you are thinking about shoulder pain, it's not just the shoulder we're gonna treat, it's the shoulder, the upper back, and the neck. So let's take a look at how well the upper back is moving. So I'm gonna have you interlock your fingers, and sitting in a good firm surface, I'm gonna turn both directions and see how far you can go. So first I'll turn to my right, get a sense as to how far I can go, how comfortable it is. And then I'm going to turn to my left and do the same thing. Now this may not be painful, and that's okay. That doesn't mean you're not going to use it for a treatment. What you are going to do is you're going to think to yourself, which felt easier? And so what we're going to do is we're actually going to treat the bad by using the good. Here's what I mean by that. If I turn to my right, and I turn to my left, and I realize, you know, I think I can turn to my right a little more than my left. So what I'm going to do is, on these next exercises, I'm going to prioritize turning to my right. So here are the two things that we're going to do, knowing what your baselines are. You know how much pain and discomfort there is when you raise your arm, and you know how easy it is to turn one direction versus another. So with my uninjured side, I'm going to raise my arm up into the air with purpose, really feeling like I'm elongating this side as high as I can go. And I'm going to do that 15 times, up and down and up and down. Take your time, there's no rush. After you complete 15 repetitions, the next thing you're going to do is you're going to turn in the direction that worked really well for you. So I would turn to the right 15 times, and I'm not trying to create a lot of momentum, I'm just turning. And after I finish 15 of those, that's the end of the first set. And then I do a second set. So again, 15 reaches with my good side, up as high as I can go. And then 15 more turns to the side that's easier to turn. Now when you're all done with that, it's time to reassess how well things are going on your injured side. So thinking back to what your pain level was, and how high you can lift your arm, you're going to sit in that same chair, and much in the same way that you lifted up the right arm, you're going to see, how is my lift on the left arm now? Can I get it higher? And what's my pain level? Or, if you can't quite get it higher, did that change the pain level? And what you're looking for is you're looking to see is, did either one or both of those change? And if they did, then your homework is to continue 3 times a day, morning, midday, and evening, that exact same round of exercises. You lift the good side 15 times, you turn toward the easier side 15 times, you do that one more round, and always testing and reassessing. And if that works well for you, and you're starting to see some improvement, that's excellent. Just be sure that as this starts to feel better, you don't want to rush into it. It's still uncomfortable. There's still some inflammation in there, and there's still probably some swelling on the inside that makes that shoulder a little harder, a little more irritable. So even when it feels good, we don't hop right to it and get right back to work. But you work within the parameters that it gives you, and do that over the next 1 to 2 weeks. Now, if you tried this test and this didn't work, it's okay. There's still a lot that we can do. What I would like you to do is reach out to me today. Contact me so that way we can arrange an initial appointment so I can learn a little bit more about you. Learn more about how you need to be able to use your shoulder, what you're feeling up there, what sort of radiations you may be feeling. Does it hurt more in the morning? Does it hurt more in the evening? And then with those questions and a detailed evaluation, I'm going to help you figure out what's going on in your shoulder so we can get you on a plan so that way it'll move better, it'll feel better, and you can do everything you want to be able to do.